So this is the medical foster animals class. The intention behind this class is to go over some of the really common conditions that we run into when we're fostering puppies, kittens, cats, and dogs. Um, I have a couple of different goals, and a big part of that is getting you comfortable with the terms, with the medications, with expectations on what to watch for, what is an emergency, when do we want you to kind of monitor and just keep a close eye on the animals, when you're monitoring your foster animals, what is it that you're wanting to look for, what do you need to pay attention to, and then kind of setting the expectation of what is treatment going to look like. And for me, I think having all this information ahead of time makes it a lot less intimidating when you're in the foster office for an appointment and you're getting 4 or 5 different medications packaged up and sent home with you. I think it's a flood of information sometimes. So even just being exposed to it and having a general idea of what to expect can make it a little less overwhelming when you come in for a sick appointment. So we're going to talk about when to monitor versus when to schedule an appointment. For some of these conditions, what does an emergency look like? What should you be looking for? What is your treatment going to look like? So what medications are you going to be taking home with you? Some of the conditions that we manage are assigned a number category of 1, 2, or 3, so that we are able to really easily identify the severity of their condition. Because we use that in the shelter, that kind of bleeds through into our communication with the foster parents. And I think understanding what a 1 or a 2 or a 3 is helps you to understand what you're getting into or what you're looking at with your foster animal. Just as a really quick overview, what we're going to talk about is going to be upper respiratory infections, conjunctivitis, diarrhea, ringworm, panleuk, and parvo. So those are the main topics that we're touching on. There are other medical conditions that we aren't going to be able to get to in this class, in this presentation. I am definitely available for email or phone call. I'm also going to be on for a little bit after the class finishes. So if you have questions that you want to talk through, please make a note. You can add it into the chat, or you can write it down with a pen and paper. And I'm happy to chat through what questions you have once the presentation is done. And if we don't have the time or the capacity today, I'm always happy to do a phone call or an email and talk about it at a different time. So starting with upper respiratory infections. These are categorized as a URI 1, 2, or 3. And so when you have an animal that's already diagnosed as having an upper respiratory infection and going out to the foster home, or if you bring them in for an appointment and we're assessing them here in the office, we might refer to it as a 1 or a 2 or a 3. With a URI 1, typically what you're going to be seeing is clear nasal discharge. So there's no yellow or green, there's no cloudiness. You might see occasional sneezing. You might see congestion. We don't see that as much with a URI 1, but it does happen. Typically with a URI 1, what we're going to advise you to do is keep a close eye on them over the next 2 to 3 days. Watch for those symptoms to worsen, specifically looking for yellow or green discharge, because that gives us the indication that there's a bacterial component, and that's when we're going to start antibiotics. What you also want to be watching is appetite, outputs. Are they eating? What's their activity level look like? We'll talk a little bit about that, I think, on the next slide. When we're looking at it and we're seeing a URI 2, that is when we're identifying that there's cloudy or yellow or green nasal discharge. More often, we're going to see some of the congestion where they're having a hard time breathing, or you can hear them breathing. There's going to be probably more frequent sneezing. With specifically the cloudy yellow green nasal discharge, that's when we want you to reach out and schedule an appointment, because we are going to start antibiotics at that point. A URI 3 is more severe, and so it is all of the same symptoms, but you're going to see a lot more of it. So large amounts or copious amounts of nasal discharge. With URI 3 cases, a lot of times these guys have just their noses are crusted over, they're gunky on their face. We're cleaning them with like wet gauze or a warm washcloth a couple times a day. With URI 3s, we also, if they're in a foster home, we're going to recommend using a humidifier or having them in the bathroom when you take a shower, so they have that steamy heat to help try and decongest them. With a URI 3, we do want to get them in as soon as possible. We want to keep a really close eye on them. Again, same things that you're looking for. So monitoring appetite, monitoring their activity level, watching for their outputs on how, are they pooping? Are they peeing in the litter box? Are they themselves? Are they kind of shutting down a little bit? With URI 3, just to give you a reference, typically if we have a cat or kitten I would say if we have a cat or a dog in shelter that has a URI 3, we are not going to have them available out on the adoption floor because typically those guys are so sick that it can be distressing when you see them. So those are the ones that you're going to see in the kennels in the back of the house where they, again, are just snotted over, crusted noses, having a hard time breathing, looking and feeling kind of dumpy and kind of yuck. With upper respiratory infections, what you're watching for. So we want to look at what their activity level is. Are they a playful, active kitten? Are they kind of shut down and not being themselves? Are they kind of lethargic and acting dumpy? What is their appetite? Specifically with cats and kittens, when they get an upper respiratory infection, they get congested, they can't breathe really well, and we really struggle with them eating because they can't smell the food. So they don't know that it's there and it's not tempting them. They're not, it's not triggering their appetite. They're not hungry. They're just kind of shut down, kind of unaware of the food. So what we can do is try and offer a couple different kinds of food, different proteins like seafood versus chicken. You can warm it up in the microwave for 5-6 seconds. You want to make sure that it's not too hot because you don't want them to burn their mouths, but that can help it to be more aromatic and kind of tempt them into eating. What we want to look at are their outputs. Are they urinating? Which means that they're drinking and taking in enough fluids. Are they pooping? With cats in the shelter, if we're looking at their outputs, we want to see them pooping once a day or every other day. Typically, if they're pooping every other day or once a day, then we feel pretty confident that they're eating enough food that it's sustainable. With kittens, you're going to see poop more frequently throughout the day, but you want to keep a close eye on, is that daily? Is it multiple times a day? Are we having other concerns where they're also having diarrhea, or are they not eating anything so they're not outputting any poop, any urine? With their hydration status, you can check and see if they're hydrated. You can actually check this on yourself. So if you take the back of your hand and you pinch the skin on the back of your hand, when you release that pinch, if you're hydrated, that skin should really easily go back into its normal position. If you're dehydrated, it causes the skin to kind of be sticky underneath. And so that skin tint will stay pinched even after you let it go. And there's a delay in the skin kind of moving and settling into its normal position. So that is a tool that we can use on cats and dogs. It is a tool we can use on kittens. It is a little bit less accurate with kittens, especially the younger they are, the harder it is to really assess their hydration accurately. But that is a really easy, quick tool that you can use at home to assess, like, is that skin that's being pinched, is it kind of staying up? Is it delayed? Is it staying in an abnormal position when you check their hydration status? Another thing that we're looking at as technicians and as foster staff, but also something to be aware of as a foster parent, is if they have oral ulcers. So the Calicium virus can cause upper respiratory symptoms. It can cause an upper respiratory infection. And when Calicium is the cause of that upper respiratory infection, we can also see oral ulcers on the tongue of cats and kittens, not dogs, so specifically cats and kittens. But it's going to be, it can be pinpoint, it can be pretty small. It can be 2 or 3 millimeters, but it's going to be like bright red, it could be dark red, and it's going to be an ulcer or a sore that's on the surface of their tongue. This is a concern because it is painful. So if we identify that, we can provide pain medication. But if we also identify that, then we also want to keep a close eye on their appetite and make sure that they're eating, because if their mouth is sore and painful and they can't smell, they're at an even bigger risk of not eating and starting to lose weight and kind of deteriorate. I'm going to go over some of the medications that we use to address upper respiratory infections. So typically doxycycline is our first choice. It is the most appropriate antibiotic to use. It works really efficiently in combating upper respiratory infections. If we do doxycycline and we don't see a response to the antibiotics, or in some cases, specifically nursing moms or really young neonatal kittens that are, like, I would say about 3 weeks or younger, our veterinarians will sometimes weigh in and ask us to do clavamox instead of doxy. If the animals are not responding to the course of doxycycline, then clavamox is the second antibiotic that we'll use, unless it's a neonatal or a nursing kitten. Because of some of the side effects that doxy can potentially cause, we might choose to do clavamox first and then do doxy as a second course of antibiotics. But either way, doxy and clavamox are going to be in a liquid form for kittens and cats. We do have tablets if we're using them for dogs. So they're bigger, heavier, higher doses. And then doxy is going to be once a day for 10 days. Clavamox is typically twice a day for 7 days. And then we do have a third antibiotic that you see. This comes up more often with cats that are immunocompromised or like FIV or FELV positive. Because they tend to have chronic upper respiratory infections. So azithromycin we typically bring in on cats and dogs when they've gone through doxy, they've gone through clavamox, and they're still struggling to recover. It's kind of a bigger gun that we pull out, but we don't use it as regularly because typically doxycycline works really well and we see a response to that antibiotic. Other medications or treatments that might come up while we're also assessing and supporting through upper respiratory infections. Convenia is an injectable antibiotic. It's given once. It works inside of the animal's body for up to 2 to 3 weeks. It's not a great antibiotic specifically for upper respiratory infections. The benefit is that we can give it once and then we don't have to have hands on the animal on a daily or twice a day basis. So this is consistently or most regularly used for cats and kittens that are in behavior programs where we're trying to build trust and it's difficult for us to be able to handle them and administer oral medications once or twice a day. We also use it for our SNR or our feral cats that are here in the shelter. We can't safely handle them. We do not have the ability to administer antibiotics, but if they are showing signs of an upper respiratory infection, we do want to do some type of treatment to help get that under control. So we will give Convenia and then we do 3-day rechecks to make sure that they're improving. We do have intranasal FERCP. So FERCP is the combo vaccine that we give to our adult animals coming into the shelter. They get a booster 2 weeks after coming into the shelter. With our cats and with our kittens and our dogs, with our kittens and our puppies that are coming in that are younger, they are going to get that FERCP or DA2PP vaccine when they first come in, and then they get boosters every 2 weeks while they are working to get up to 2 months, 2 pounds, and become adoptable. Typically, we administer FERCP as an injectable vaccine. We are able to use an intranasal version, which means that we shoot the vaccine up their nose when they are having issues with conjunctivitis or upper respiratory, specifically because the intranasal form works really well against the calicivirus, which can cause upper respiratory infections. The intranasal version is absorbed into the body faster than the sub-Q injectable vaccine. And then it has actually shown in studies to help cats to recover from upper respiratory infections quicker. So we'll use the intranasal FERCP if they're having conjunctivitis or upper respiratory concerns, but also they have to be due for that vaccine or it's not as helpful or beneficial. So you may or may not see that come up in your appointments. Benebac or Fortiflora are 2 different types of probiotics that we give. These are typically given once a day for 5 days or for 7 days. The probiotics, the aim or the goal is to help boost their immune system, and it's also to help try and counteract the impact that antibiotics have on their gut flora. So it's both to help support their immune system and help try and get over that upper respiratory infection faster, but also to kind of balance out or counteract the impact that antibiotics have on our on our system. Syringe feed is going to be supplemental. So with syringe feed, we typically use AD because it's gelatinous. So you can stir it with a spoon and very easily feed it through a syringe. You can also blend up kitten food or cat food if needed in the foster home, but AD is definitely going to be a little bit easier. Syringe feed is a supplement. It is not going to directly impact the upper respiratory infection, but it's something that we can do to help keep the animal, specifically cats and kittens, but all of the animals eating, putting some food in their system, helping to manage their blood sugar, helping to make sure that they're not feeling gross and icky because they're not eating, in addition to feeling gross and icky because they have an upper respiratory infection. Topical mirtazapine is a tool that we use. It is a topical ointment that is applied to the inside of the ear. It is an appetite stimulant, and it is most often used in cats and kittens, and it's typically administered once a day for 3 days. So you have to wear a glove, you smudge it on the inside of the ear, and you let it sit and absorb, and it helps to just encourage them to be hungry and start eating. I didn't add it on here, but we also have Entice, which is an oral appetite stimulant that you give that can be used in both cats and dogs. And again, it's not to address the upper respiratory, but it's to help encourage their appetite and help keep them eating while they're trying to recover from the upper respiratory infection, and while we wait for those antibiotics and those other supplements to help support the animal and getting them to feeling better. So what does follow-up care look like when you're dealing with upper respiratory? Typically, when in a foster home, we do follow-up appointments as needed. So if you feel like the kittens or cats or dogs are getting worse, if you feel like you don't see a response within 2 to 3 days of starting antibiotics, we want to see you back in the shelter. There are some severe cases where it is an upper respiratory URI 3, or there's other comorbidities that we're worried about, where we might proactively say, hey, we really want to see you in 3 days. Let's go ahead and schedule a vet check with one of our veterinarians. But more often than not, upper respiratory is that initial assessment, starting the medications and the supplements, and then managing it in the foster home with follow-up appointments kind of as needed. My recommendation is to reach out to the foster home or foster office when you have a day or two left of the antibiotics, if you still feel like there are concerns. So if you're on 10 days of antibiotics and you're on day 8 and you're seeing they're still congested, they're still sneezing, they're still kind of lethargic, I don't feel like this is going to be completely resolved by the end of the day, or by the end of the 10 days, the course of antibiotics. At that point, I would reach out to the foster office and say, hey, I really want to get in the next day or two and just check in and see if we need to extend or do a different treatment for my kiddo, especially during the kitten season. So starting in March and April, our numbers start to pick up and the number of animals that are out in foster homes gets really high. That busy season goes through typically September and then into October. So peak kitten season months, I say, would be June, July, and August. When we hit that point in the summertime, we are typically double booked all day. We have emergency appointments available each day, but those do fill up really quickly. And so the expectation of reaching out to foster, you are going to have a day or, typically a day or two wait to get in for that appointment unless it's an emergency. So that's why I recommend, kind of with a day or two left of antibiotics, that's a great time to reach out and put it on foster staff's radar and get an appointment scheduled in the books. I want to touch on SMAM URI because we do see cats, dogs, and SMAMs. SMAMs is more of a set structure. So typically we start 2 weeks of antibiotics. It is enrofloxacin. So it is a liquid medication that's given for twice a day for 2 weeks. With SMAM specifically, we always involve a veterinarian because they are usually really straightforward. So either they respond really well to the antibiotics, they clear the upper respiratory infection, and they're good to go up for adoption, or they tend to be complicated and it's something more serious like cancer that's underlying, that's causing a compromised immune system. And in those situations, we have SMAMs that are on antibiotics that just do not improve. They don't respond to the antibiotic treatment. They don't feel better. And we kind of sit in the same situation that we're in at the beginning when we check in 1 week and 2 week with the doctors. So it tends to be either they do really great or they do really poorly. And because SMAMs are complicated on kind of what is it that's causing that upper respiratory infection, we always have a veterinarian involved in those cases. We will do a weekly DVM check. So we'll check in at the 1 week point. Sometimes they clear medically and go up for adoption at that point. Sometimes they do need to stay in foster for that full 2 weeks before they clear. With the enrofloxacin, which is the generic name, or Baytril, which is the name brand for that antibiotic, we can cut that antibiotic with just a little bit of like apple juice to make it taste a little bit better and make it easier to administer. You want to be really careful because you don't want to give the SMAMs a ton of sugar, but that does help it to be less of a stressful situation for them getting those antibiotics. So moving from upper respiratory to conjunctivitis. Conjunctivitis is another situation where we do grade it as a 1 or a 2 or a 3. Similar to upper respiratory, you're going to see the same symptoms, but they're going to be more severe as you hit a 2 or a 3 category. So looking at conjunctivitis 1, mild chemosis, that means that pink mucous membrane that's inside of the eyelids is kind of swollen and irritated. Mild erythema is going to be redness, so just kind of red eye. I think that's what we think of in humans when we talk about conjunctivitis a lot. You might see clear discharge, and then you might see blepharospasm. Blepharospasm, I always struggle with saying it. It's actually just when they're winking, when that eye looks like crusty or uncomfortable or irritated, and they're squinting or winking, and they've got one or both eyes that are just not fully open and comfortable. With conjunctivitis too, you're going to see all of those signs and symptoms, or you could see some of them. It's just going to be a little bit more severe. So moderate chemosis, moderate erythema. You might see clear discharge, but you also might see yellow or green discharge, and you can see that squinting. With conjunctivitis 3, all of those same symptoms might be present. They are going to be severe instead of mild or moderate. When I see a conjunctivitis 3 case in the shelter as a technician, if I'm going to score it as a 3, typically with those cases, the mucous membrane is so swollen that I cannot see the entire globe of the eye. I might not be able to see the eye at all. And so sometimes there is a concern when those kiddos come in with conjunctivitis 3, is there an eyeball? Has the eyeball ruptured? Is there a congenital defect where there's not an eyeball? So with conjunctivitis 3, those are always cases where we're going to involve a veterinarian, because the veterinarian can numb the eye. They can clean the area around the eye and inside of the eye, and then they can do an exam and see what's going on under all of that swelling and that irritation. With cats, consistently we do tobramycin. This is typically twice a day for 7 days. If they're doing well on Tobra, but it's not completely cleared up on the conjunctivitis, we may extend and do a second week of tobramycin. If the tobramycin does not completely address the conjunctivitis, or if the animal has an adverse reaction to the Tobra, we will switch over to ofloxacin. So I have had, I would say, 1 to 2 cases a year that I am aware of where we start a kitten or a cat on either Tobra or oflox, and for whatever reason that individual animal has a really severe reaction, and the conjunctivitis gets severely worse pretty quickly within that first day or 2 of starting the eye drops. It doesn't happen very often, and I've seen it both with oflox and Tobra. But if that happens, let the foster office know, and we'll get you transitioned over to the other eye drop that the kitten is not currently on. There are a couple of other medications that you might see. Tobra and oflox are going to be the most consistent, and we do really regularly see a good response to both of those. But you might also see that we give an intranasal FVRCP. There are some cases of conjunctivitis that are ongoing, that are kind of chronic, where the doctors have decided to start a course of antibiotics to see if that helps with the inflammation and the irritation of that conjunctivitis. Famvir is not a medication that I see very often right now, but it's actually an antiviral medication. And it's just another tool that we have in our toolbox that might help in certain cases or situations. Erythromycin is an eye ointment that we can use for cats. There are some side effects associated with it, so that's why it's not our main 2 that we start with. Idoxyuridine is also something that can be helpful. We've used it in cases where it's kind of chronic conjunctivitis where we're not seeing any response to medications. With the idoxyuridine, it has to be used very regularly. So I think it's like 5 or 6 times a day instead of once or twice or 3 times a day. And so I think that is a big challenge of if we can't get it in 5 or 6 times a day, it's not going to be efficient. So it's not one that we use as often because it's a little bit harder to implement. Prednisolone and dexamethasone are both options that we have. Both of those are associated, they're steroids. So we try to be really cautious when we start steroids. There are benefits to using them, but one of the cons to using steroids is that it can further compromise or lower an immune system. And when we have animals that are in a high density environment like a shelter, and when we have animals that have compromised immune systems where they're already sick, they're already experiencing a high level of stress, adding steroids into that situation can cause issues. So we always are very cautious and careful. We do feel a little bit more comfortable using steroids when the animal is out in a foster home because they are not experiencing as high a level of stress typically, and they have less of an opportunity to be exposed to a different contagion that they could pick up and break with. With dogs, they're a little bit more straightforward. We don't see conjunctivitis very often, and when we do, we use triple antibiotic ophthalmic ointment. So this looks like the 3AB ointment that humans use like when we have a cut or a scrape and we need to do ointment and a Band-Aid, we do use a specific formula that is for ophthalmic use. So it's not exactly the same, but it's going to look similar. We use that twice a day for 7 days. I know recently within the last 2 to 3 months, this went on back order. And so what we ended up doing was using Tobra or ofloxacin for our dogs that were experiencing conjunctivitis. But that hasn't happened in the last 10 years that I've been here. And I don't anticipate that it'll happen regularly in the future. Dogs are, again, it doesn't happen very often. It's usually pretty straightforward. And they usually respond really well to the triple antibiotic ointment that we use. So what is this going to look like for follow-up care? Similar to upper respiratory infections, typically this is managed in the home. We can do follow-up appointments at the end of medications as needed, or if your animal has a really severe reaction to the medication and we need to transition to a different treatment plan. There are some cases that are more severe where we're going to schedule 3-day rechecks. Or we might want to see them at the end of the meds to confirm that they've cleared. A lot of times this is when there's an oral ulcer in place. So not oral, an ocular ulcer in place. So there is an ulcer on the surface of the eye, and we're monitoring to make sure that that ulcer is healing, that it's becoming smaller. And we're also pairing our treatment plan up with some pain management to make sure that the animal's comfortable. Some things to keep in mind if you have a foster animal that has conjunctivitis that is just not getting better is that there can be some conditions present that is causing the conjunctivitis to reoccur over and over again. So a couple of those things I have listed. One is entropion, where the animal is born with an eyelid that is rolling inward. And so those eyelashes and that fur is rubbing against the eye and causing irritation. We do corrective surgery to address that entropion, which positions the eyelid the way that it should be positioned, and that helps to support to kind of clear up that conjunctivitis. Another condition is eyelid agenesis. This is a congenital defect that we see with kittens where they are born and they have a partial eyelid or they have no eyelid. And so they aren't able to blink the way that they normally would. We sometimes see the eyelashes or the fur rubbing against the eyeball and causing trauma. This is also something where it's a little bit more specialized, but we can do some corrective surgery to help support. That animal might need lifelong eye drops or ointment to help moisturize their eye, but that can be an underlying condition that'll cause conjunctivitis, and we'll see the conjunctivitis respond to the Tobra or the Oflox, and then it keeps reoccurring, and it's because that underlying condition is still there and it hasn't been addressed. Trichiasis is where the eyelashes grow inward, and so they're pointing at the eye and again causing physical trauma. With that, we can do cryoablation where we freeze the individual eyelashes. We freeze the root of the eyelash falls out, and then it doesn't grow back, and so it stops causing that trauma. And then the other thing is ocular ulcers. So a lot of times when we see ocular ulcers, it is conjunctivitis that has been present that has not been addressed. Typically when we see these, it's litters of kittens that have come in that were found in a shed, found in a garage, brought in from a feral cat colony where there wasn't a primary caretaker, or if there was a caretaker, they were not aware of the conjunctivitis. And so it's been ongoing and it's been untreated. And so that irritation being there for such a long time has caused erosion on the surface of the eyeball, and an ulcer has formed. Moving along to diarrhea. So poop in the shelter setting. We have a fecal score system that all of our departments reference. We do have this printed out in the foster office if you want a paper to take home and reference yourself. Fecal score 1 is on the top left corner, and that isn't necessarily a good thing. So fecal score 1 is dry, it's hard, it's kind of pebbly poop. A lot of times if we see that, we're actually worried about constipation. We might be worried about megacolon, where the animal's not able to comfortably poop regularly, and so they're having a backup in their GI system. I would say with the fecal score like 2 to 5, we see a range of that within the shelter. And for the most part, we think that's normal. So it can be anywhere between a 2, 3, 4, or a 5 without causing concerns. A lot of times when we are starting diarrhea, what we're looking for is that fecal score 6 or 7. So it has texture, but it's not a defined shape. It occurs in piles or in spots. It leaves residue when you try to pick it up, or it's watery. It's a puddle. It looks like a cow pie. That's when we want to do intervention and start treatment. There are a lot of medications that we use for diarrhea, both to address the diarrhea, but also to give support to the animal. So probiotics, which we touched on with upper respiratory infections, we have Binabac, which is a waxy probiotic that you can give orally. Fortiflora is a name brand from Purina that is a probiotic. It's a powder that you mix into the wet food. Synacor is a generic brand. It's a probiotic also, but it's from a different distributor. And that, again, is to help boost their immune system and help reestablish healthy gut bacteria. Prescription food, we try to do dry and wet ID. We can give this to puppies, to kittens, to adult cats and dogs. It's approved to use for puppies and kittens who are still growing, who need that higher calorie intake. The big thing to know is that we would rather have a kitten that eat, or a puppy. Puppies typically eat anything you give them, but we would rather have a puppy or a kitten that's eating something than have a kitten that's not eating, because we're only offering it ID and it's not eating it. So we're going to try and use dry ID and wet ID as a tool. If they're not using it, we'd rather have them eat. So we can offer regular kitten food. We can offer stinky food. We can try AD, which is the critical care canned food. As long as they're getting food in the system, if they're able to eat the ID food, then that's going to help them to recover from the diarrhea a little bit quicker and faster. Vitamin supplement, so specifically kittens, we will send them home with a vitamin supplement. This is because when they are experiencing diarrhea, that food that they're ingesting is moving through their GI tract faster than it should. And so they don't have the ability to absorb the vitamins and the minerals and the nutrients that they normally would. So we'll do 2 to 3 days of a vitamin supplement to try and help balance out the nutrients that they're not getting from their food. And that's, I think, initially during those first couple of days, because we're starting medications for the diarrhea and we're trying to give the body time to respond to those diarrhea meds. We've got 3 different medications that we use specifically in treating diarrhea. One is going to be Panacur. That can come as granules that you mix in with wet food or as a liquid. It is shelf stable, and typically we give it once a day for 5 days. We use Panacur for both cats, kittens, puppies, and dogs. Metronidazole is typically a liquid. We do have a pill form, but that's usually for dogs because they're bigger, so they have a higher dose. Metronidazole can be bitter, so it doesn't have a great taste to it. It needs to be refrigerated, and it's typically given twice a day for 7 days. Metro is the medication that you're going to get a really adverse reaction from your foster animal. So they tend to be a little bit dramatic, and they spit and they hiss and they drool and they get really upset and grossed out by the Metro because it has kind of a stronger bitter taste. Routine dewormers. So Panazaril is something that we give routinely to underage puppies and kittens. We give it when they first come into the shelter, and then we booster 2 weeks later. We have incorporated Panazaril in our diarrhea SOP. So we will do once a day for 3 days on top of the doses that we normally give with our vaccine schedule. Pyrantel is typically given with vaccines, so it's not part of our diarrhea protocol, but it's something to keep in mind if your fosters are due for vaccines soon. Getting that Pyrantel on board may also help address the diarrhea that you're starting to see. Panleuk is an ointment that we use to help when the skin is irritated, specifically around kind of the anus, rectum, and hind legs, especially with kittens that are experiencing watery diarrhea. You can see some scalding and some skin irritation. And so making sure that that skin is clean, it's dry, and then being able to put that ointment on provides a little bit of a protective barrier and helps it from getting that skin from being further irritated. Another tool that we use is sub-Q fluids. If your animal is dehydrated and experiencing diarrhea, they're losing more fluids than they would normally. So we're going to try and balance that out by administering sub-Q fluids. Depending on how dehydrated they are, it may be that we just give 1 dose of sub-Q fluids in the office to help give them a little bit of bump to get caught up and back to being euhydrate. It might be that we do 3 to 5 days of sub-Q fluids if we see that they're mild or moderately dehydrated, and we're really worried about making sure that they're feeling supported and giving them an extra boost while we wait for those medications to start. Hydrocare is a wet, it's kind of a liquid form, a liquid food that we can give. We don't typically administer it like a medication, but you can offer it first, like instead of wet food, and it helps to encourage hydration. It helps to pull hydration into the cells. And so if the animal is really difficult to give sub-Q fluids to, either because of behavior reasons or because of you as a foster parent really being uncomfortable giving sub-Q fluids, HydraCare is something that we have kind of a tool in our toolbox that we can use in lieu of sub-Q fluids so that we have options to choose from. Oh, that's not right. Hold on a second. I think we have an extra slide. So follow-up care. Quick treatment and management is essential for diarrhea. The hard part with this is that there are a lot of factors that can cause diarrhea. So your foster animal can be stressed out because they just went into a new home. They could be having diarrhea because they're transitioning to a different food. They're transitioning from being a bottle baby to eating real food. All of that can cause a little bit of GI upset. What we typically advise in the foster office is that a couple of episodes of diarrhea are okay. If you're seeing a couple of days of diarrhea, then that's when we need to step in and intervene and start diarrhea medications. So 1 to 2 episodes of diarrhea is okay. If it's more than that, let's have a conversation and start diarrhea protocol. Let's offer ID wet food. Let's get you into the office and get you seen and kind of assess what's going on. Follow-up appointments are typically at the end of medications if the diarrhea isn't resolved. So we send you home on diarrhea protocol, the medications are coming to an end and you're still experiencing diarrhea or soft stool hasn't completely gone away. We're going to have you come in for a follow-up appointment. If they're on medications and they're doing really well and they're really responding, we want to make sure that you're continuing the medications. You don't want to stop them early, but you aren't necessarily going to come in for a recheck just to confirm that they're doing well. With kittens, we just as a warning, we do experience situations where there are extended treatments where we have to do a couple weeks of medications. We also have situations where a kitten might have diarrhea at 6 weeks of age, and then it might reoccur and have diarrhea at 9 weeks of age. So we're going to have to repeat that diarrhea SOP. It's not anything specifically that's wrong with the kitten or with you or the care of the kitten, but we do see diarrhea happen and we see it reoccur quite often, especially with kittens. All right, so just to check in, it is 10:40, so we've got about 18 minutes left. We're going to talk about ringworm, we're going to talk about panleuk, and we're going to talk about parvo. And then again, I'm available afterwards if you want to talk through any questions you might have. And I have my contact information at the end of the slideshow if you want to give me an email or a phone call. So ringworm is not categorized in the same way that upper respiratory infections or conjunctivitis is. There are some frequently used terms that I think are helpful to understand when you're looking at ringworm or dealing with ringworm. So what you're going to hear is ringworm exposed. This can be a direct exposure or it can be an indirect exposure. You might hear derm surveillance, and that means that they're either suspicious for ringworm, they might have it, they might not, so we're quarantining them to confirm if they have ringworm or not. And then you're also going to see post-treatment animals where they have recovered from ringworm, or you're going to hear that your animal is ringworm positive. So to go into the details a little bit, if an animal is directly exposed, that means that either a litter mate or a housemate, so an animal that came from the same home as them, were diagnosed as ringworm positive, and this animal is directly exposed because they've had direct interactions with that animal and they may have ringworm, but they may not be showing signs or symptoms of it. So it's kind of a caution. Indirect exposure more often happens while they're in our care, and that's usually when they're kenneled next to an animal that is diagnosed with ringworm, or they are transferred on a van with an animal that is later diagnosed with ringworm. So they may not have had direct interaction with that positive animal, but it's possible that someone pet the animal that is now positive and then pet this animal, or it's possible that someone cleaned the kennel right next to them and then cleaned this kitten, the exposed animal's kennel directly afterwards. So there is always the possibility that they were exposed to ringworm. Typically, they're not showing signs or symptoms, so they don't have hair loss or lesions, but we're worried that they may start showing signs or symptoms of ringworm within that upcoming week or two. Post-treatment means that they had ringworm, they've gone through antifungal oral meds, antifungal rinses, they've recovered, they no longer have ringworm now, but they might have medical or behavior concerns where they're not quite ready for adoption, so they're looking for foster placement. They aren't ringworm positive, they're not shedding ringworm. Typically, I think these guys are considered the safest because they've been on antifungals for 2 or 3 months, but you might see that pop up as a foster animal. Ringworm positive, most often, this is going to be when you take an animal home and you see a an area of hair loss pop up within that first 2 weeks of fostering, and you bring them in for a healthcare exam, and we're able to diagnose that they have ringworm. Two situations where we specifically seek foster placement for animals that are ringworm positive. One is going to be when we have a SMAM, typically a rat or a guinea pig that has ringworm. We don't have the quarantine space to be able to manage and treat the ringworm and get them to the point where they're ready to be available for adoption, because we don't have that capacity within a shelter setting. If we are treating a SMAM for ringworm, it has to be in a foster home environment so that those animals are quarantined and not exposing the general population, not potentially spreading the ringworm to the rest of the animals that we have here in the shelter. The other situation is for kittens, specifically kittens that are under 1 pound, have a really hard time thriving in quarantine. They have limited interaction with the staff. We have limited eyes on them. It helps to have a consistent person monitoring them so that you can identify when there is a shift in activity level, when there's a shift in their appetite, their inputs and their outputs. We also aren't able to give as much supportive care when they have their twice a week antifungal rinses. So they get a rinse with a special shampoo. The shampoo has to air dry. With kittens that are under 1 pound, they have a hard time thermoregulating. So even though we give them warm, dry towels and we give them heating discs, it's a little bit harder to keep a close eye on them, and they struggle with those rinses. So if we are managing kittens that are under 1 pound that are confirmed ringworm positive, those guys have to go out to a foster home to be managed versus being kept in the quarantine of long-term medical cat here in the shelter. So symptoms for ringworm, you're going to see circular areas of hair loss. Typically, we see signs or symptoms within 2 weeks. So that's one of the reasons why we recommend quarantining your fosters for those first 2 weeks in the home. You're going to see red, dry, flaky skin. You're going to see broken fur strands. So that means it's kind of bristly because the fur has broken off because it was weakened by that ringworm infection. Most frequently, we're going to see those areas of hair loss around the eyes, around the mouth. It can be on the toes or the paws, or you can see it in the armpit or the inguinal or groin areas. I've got a couple of good pictures of ringworm where you can see kind of red skin, dry and flaky skin. It looks bald. The hair coat looks kind of patchy. With ringworm, they're going to be on a antifungal oral medication. This is a once-a-day medication that is shelf-stable. Terbinafine is a antifungal tablet that we use for more often puppies and dogs because they're larger, so they require a higher dose. We give them terbinafine tablets instead of the liquid itraconazole. All ringworm animals are going to get medicated baths, so they get antifungal rinses twice a week. We use a toothbrush to brush the fur of the animal and collect spores from the ringworm. We transfer those spores and hair onto a DTM, which is a dermatophyte test medium. We put that into an incubator here at the shelter. It is a very firm answer on it. It can indicate, yes, it has ringworm and how heavy is that ringworm infection. The downside to the DTM is that it takes 2 weeks to fully incubate. So we don't have a really solid, quick answer on, yes, it's ringworm or no, it's not. And that's going to be why you see some cases that are derm surveillance, because we're quarantining them for 2 weeks while we wait to confirm if they have ringworm or not. One other medication that you're going to see specifically with SMAMs is that we have vitamin C tablets. This is an alfalfa tablet that has vitamin C in it. We give 1 a day to our guinea pigs, and that helps boost their immune system and helps get them recovered from ringworm. Follow-up care, if you're caring for ringworm in your foster home, a lot of what we need to do can be done in the home. So you can send you home with the medicated shampoo, the oral medications, a scale to get weekly updated weights. We can send you home with the toothbrushes to collect those spores, put the toothbrush in a Ziploc bag and bring it into the shelter. Some cases are better treated in foster homes. So what I said specifically, SMAM, ringworm, and then kittens that are under 1 pound versus managing those cases in the shelter. Treatment in cats can take up to 2 to 3 months. So this is a long haul treatment. What I've seen with dogs and SMAMs is that they typically recover a lot faster. I specifically have fostered SMAMs with ringworm, and the guinea pigs typically clear within 3 to 4 weeks. And part of that is just the wait time of the DTMs fully incubating for 2 weeks and giving us those test results. When an animal is under ringworm treatment, they're going to get weekly DTMs that need to so a weekly toothbrush that needs to be brought into the shelter. And then we need 2 DTMs that are negative for us to consider the animal cleared medically from ringworm and being able to stop those medications and those treatments. So parvovirus, we're going to talk about parvo. We're going to talk about how it presents in puppies, and then we're going to talk about how it presents in kittens. So it's a very similar virus. It is species specific. So your kitten cannot get parvo from your puppy, and your puppy cannot get panleuk from your kitten. But the signs and symptoms are going to be very similar on what you see when they have an active infection. So starting with puppies, when they have parvo, the symptoms that you're going to see are going to be vomiting, diarrhea, lethargy, anorexia, and weight loss. Most often we see parvo in very young puppies, and that's specifically because the DA2PP vaccine that protects against this is very effective. So when you have an older animal that is fully vaccinated, they're really well protected against parvo. We see it in puppies because they either have not had vaccines, they have an incomplete vaccine course, so they haven't had the full 3 vaccines that are typically recommended by your private veterinarian, and their immune system has not had the time to fully integrate that protection against parvo in their body and in their immune system. So we're going to see it in young puppies or animals that have not had vaccines. You're going to see terms associated with parvo. Similar to ringworm, you're going to see parvo exposed, and it's going to be direct exposure or indirect exposure. Same as ringworm, direct exposure means that they have a litter mate or a house mate that tested positive, so they had direct interactions with that positive animal. Indirect, again, happens most often in the shelter, and that usually means that they were kenneled next to an animal that later tested positive, or they were transferred on a van with an animal that later tested positive. So there is a chance that they were exposed, even though they didn't have direct exposure or direct interaction with that animal. You're also going to see animals that are listed as post parvo. This is typically our parvo puppies that come into the shelter. They are parvo positive. They go through quarantine and treatment, and they are recovered, but for some reason they're not ready for adoption. That might be behavior concerns that need to be worked through. It might be that they're not 2 months yet, so they can't have their spay and neuter surgery. They can't go up for adoption. It might be that they're emaciated and they need to gain a little bit of weight before we feel comfortable anesthetizing them and putting them through surgery and putting them up for adoption. So that's most often when you're going to see a post-parvo puppy looking for foster placement. We need them to gain weight. We need them to get a little bit older. They're just not quite ready for adoption. Parvo positive, we do not send out to foster for care. So when this comes up, it's going to be when you're seeing those signs or symptoms with your puppies. You're going to see vomiting, diarrhea, they're being lethargic, they're losing weight, they're really not hungry and eating. We bring them in for a healthcare exam. If we diagnose them with parvo or being parvo positive, at that point, we're going to income them to the shelter. We're going to hospitalize them in our quarantine room, and we're going to manage their care here in the shelter. Always treated in the shelter. Treatment for parvo is a focus on supportive care and isolation. Because it is a virus, we are helping keep the animal comfortable, and we're supporting the symptoms that the animal is experiencing. So we administer anti-nausea medications. We will give supplemental fluids, either sub-Q or IV. We'll give convenia, which is the long-lasting antibiotic that we talked about with upper respiratory infections. The convenia in this situation is given to help prevent secondary infections while the animal is fighting off parvo. We might administer appetite stimulants to encourage them to eat. We may also use buprenorphine as a pain management tool. Buprenorphine can help keep the animal comfortable, but it also may make them lethargic and sleepy. So you want to balance out the support that it gives versus the cons or the impact that it makes on the animal. The other thing is decontamination. So making sure that when the animals are exposed, we're bathing them to remove any contagion that might be on their fur. And then we're also with parvo positive animals, we're giving them a bath before we move them out of that quarantine space so that they're not bringing those parvo germs out into the shelter environment to share with other puppies. Panleuk is in kittens. Again, you're going to see very similar symptoms. It is species specific, so it doesn't cross between cats and dogs, but you're going to see diarrhea, vomiting, lethargy, anorexia. You're going to see weight loss associated with that. Again, you're going to see it frequently with either really young kittens or unvaccinated adults. And this is because they're undervaccinated. The FERCP vaccine that works against panleukopenia is very efficient. So when you have a healthy, happy adult animal that is fully vaccinated, they're very well protected against this. With young kittens, they are either not vaccinated, they're undervaccinated, or they have that compromised, immature immune system as they're growing and developing into an adolescent, that kind of puts them at a higher risk. With panleuk, the verbiage that you're going to see is indirect or direct exposure. So again, a litter mate or a housemate that tested positive where they had direct interactions, or indirect exposure, they may have been unlucky and kenneled next to an animal that later tested positive for panleuk. Panleuk positive, you're going to see this when you bring your animal in for those symptoms. We're going to run a panleuk test and we're going to assess, is this panleuk that's causing the diarrhea and the vomiting, or is it something else? And if it's something else, we're going to start supportive care for the diarrhea, for the vomiting, for the anorexia. If it's panleuk that's causing it, then that's a different course. Panleuk is handled differently than parvo. We do not see a high success rate with aggressive treatment and hospitalization. It is also very, very contagious and hard to contain. And so because it is a low success rate, even with aggressive treatment, and because of the population that we house in the shelter that is very vulnerable and susceptible to panleuk, euthanasia is the outcome when we have a positive panleuk animal. Prevention is really the biggest key. So preventing the panleuk from spreading and occurring. One thing is isolating your new litters. So not intermingling litters, not fostering two litters and handling both litters at the same time, making sure that you change your clothes, wash your hands in between handling, making sure that you're quarantining for those first 2 weeks, disinfecting surfaces when we're vaccinating and doing exams here in the shelter. Staying consistent on the vaccine schedule. So make sure that we're vaccinating as soon as they're ready to be vaccinated, as soon as they're old enough, making sure that we stay on a consistent schedule and reboostering those vaccines every 2 weeks. And then in addition to that, there's a community focus on vaccines. So this is part of the reason why we provide low-cost vaccine clinics to the public. This is why we support our SNR and our working cats in the community and making sure that they're getting vaccinated, because those vaccines in the community are helping to prevent panleuk cases in the community. And those panleuk cases in the community are where our kittens are being exposed and where that panleuk is being brought into the shelter with the litters that are being found and the stray cats that are being found. So if we can work on consistently vaccinating our pets, helping to support the community and having access to vaccines, that's going to help keep the incident of both panleuk and parvo happening in the shelter and spreading in our shelter population. We also are very aggressive about our vaccines. So our animals that come into the shelter are vaccinated at intake, and then they are boosted for their vaccines while they're in the shelter and care, even up to the point where they're up for adoption. If they're still here in the shelter environment and they're due for boosters, we stay on top of that booster vaccine to make sure that they're as protected as possible. All right, so we made it through the presentation. I've got my contact information. So this is my direct email and this is my phone number. So 303-751-5772. Actually, this needs to be updated. We just changed over to the Ring Central. So my extension is going to be 9456. And I apologize, I can update that. But I do have the correct extension in my email, in my signature. So if you do email me or if you call the call center and get transferred over to me, I'm happy to talk through this presentation, the contagion, the concerns that we went over here. I'm also happy to touch on the other conditions or medical situations that we run into a little bit less frequently with our cats and dogs and puppies and kittens. But I am available now if anyone has questions that they want to chat through as a group before you hop off of the training. And if we don't have any questions, I just want to say really quickly, thank you for attending. Thank you for fostering. Thank you for putting in the extra effort and the energy to become more informed and more comfortable. I will say that our medical cases are the hardest cases to find placement for. They're the hardest cases to keep out and foster because they can be really frustrating. They can be really challenging. And so every step that you take to become more more informed and more comfortable is helping us to help support the population that's in our care. So.
All right. Thank you so much, Stephanie. I think we'll hang around for another minute or two just to see if we have any questions, but I will echo that thanks.
Awesome. That sounds awesome. Thank you so much. Thanks, Tristan, for helping me coordinate this and being available to help. I would not be able to juggle all of the balls and present the class, but also answer questions and let people in and troubleshoot, because I feel like IT is always my biggest fear, that something's going to stop working and I won't know how to fix it.
Yeah, no worries. I think we are good to probably head out, but
Okay.
you do have Stephanie's contact information if you run into something else.
Okay.
And it's just us now.
Sounds great. Amazing. Thanks, Tristan. I
Yeah.
appreciate you.
Yeah. Thanks. Bye.